Is that why you got a lot of chocolates in your fridge?
Hi, I'm Dr. Navdeep. I'm a obstetrician gynecologist and a fertility specialist.
And I am Dr. Niraj. I'm a obstetrician and gynecologist, and well, I work in Asunta.
Okay, today we're going to talk about issues about women's healthcare, where we'll have some topics and we're going to discuss the treatment and the methods to overcome it.
Certain remedies are easier, but I think you should choose wisely before you pick a kind of remedy for yourself. All right? So, shall we start?
Let's start.
Okay, so this hot water bag has been a common thing that has been used traditionally. All right, and it has worked for many, many years. I think that was the easiest way to try to soothe the pain because it brings down the pain a little bit. But the painkillers also can help. But before that,
I think the patient has to first go and get it checked. See a doctor, the doctor asks you questions and try to determine what's the cause of the pain. Then the doctor will do a certain test, for example, ultrasound scan, where they can have a look and see the structure in the womb and the ovaries and see what are the possible issues for the pain. And then they can discuss treatments.
so the treatment can vary for patients' specific needs. Need to find out what's the cause first, and then they will treat accordingly. Usually, if it's just pain that's giving you trouble, then of course painkillers that is naturally given for patients to just bring down the pain. Because if it's a simple, no issues at all, pain relief will be just fine. Any tablets that will be given to you on a regular basis. The other choices are there, whereby if it's a straightforward pain relief that you need, and we can control your cycle with certain kinds of birth control. But in certain conditions, you might need further intervention, as in, if at all there's a bigger problem, then you might need or require surgery. So it's very individualized for each patient.
Well, to be honest, I don't think that's the right thing to do, because irregular menses can be a sign of something going on. Okay, example, if you get irregular menses, then you may have things like polycystic ovarian syndrome or certain issues in your menstrual cycle. So you should see a doctor to get it examined.
Now, when you see a doctor for someone with irregular periods, they will go through to see how your periods have been over the last few months. And they will also ask you a few other questions to determine whether there's any other possible reasons for you to have this kind of irregular periods, such as weight gain or PCOS or any other problems that can encounter with that. After which, a simple scan will give us some clue, and maybe some further tests, like blood tests and stuff, will give us a clue on where we are going with your current problem. All right? And then the treatment will be started.
The treatment can basically be some hormonal tablets to regulate the cycle, or if you want fertility, then the doctor can give some medication called ovulation induction to get your eggs to grow and tell you when's the best time to be together, or certain types of injections where to grow the eggs, and you can do IUI, even IVF.
Now, irregular periods as such with traditional therapy, there's also people going around, I've heard about this, that they take pineapple to actually get your periods out. Yeah. But all those are actually myths, so herbal stuff, I'm not very certain. I don't think it works. Chinese herbs and stuff also, we don't have any experience with this. So I would suggest, if you're going to stick to something Western, you need to meet a doctor and then come up with something best for you. All right?
Well, yeast infections can occur randomly in any woman. Okay, so if you have a recurrent infection, then you need to go and see a doctor to ascertain why you're getting it frequently. There may be other underlying issues, for example, diabetes.
Now, these creams that you talked about is only application on the outside. Usually, yeast infection, as you know, in normal women, you can get it and it goes according to your period cycles. So it doesn't mean it's a problem, but buying them over the counter, well, it's something that you really need to relook first, because you need to figure out whether it's really yeast infection or whether some other infections that you are having. And that's when a consultation with the doctor will be able to help you out. And in usual times, they take a little sample to make sure that what they're dealing with, rather than going and buying it yourself without figuring out what you actually have.
Yes, because vaginal discharge can be multifactorial. So by determining the exact bug which is there, with the best thing to do, so doctor can give you an exact treatment for it to prevent recurrence.
And once you figure things out, then maybe later on, if you're getting the same thing, we already know what's the problem with you. And if you really, later on, if you feel that, I just want to get the pills out, you should speak to your doctor and he might be able to help you out. So in certain conditions, we will tell you, okay, if you get this again, contact my nurse. If you can't come over, then maybe, you can get it from a pharmacy yourself. But, if you keep getting it, you need to go and see a doctor. All right?
Well, technically, cranberry juice has always been there for urinary tract infections. It's true in a ways, but then again, the best thing to do is to confirm the diagnosis, get it checked, and get the exact treatment for what you're having.
Now, there are a lot of newer types also. If you're not looking for a medicinal way or pharmaceutical way, yes, cranberry juice and even probiotics has been used to be helpful. In fact, now they have a lot of supplements, they mix both of it and they are selling it in the market. But as what Dr. Navdeep says, get a diagnosis first. Don't treat yourself. In fact, even doctors also, sometimes we treat ourselves and that's wrong. You need to see another person before you get a diagnosis and treat yourself. So if you feel that you're making it easier for you by buying it yourself, I don't think that's the way, because you could be missing on a lot of crucial things and you're going and treating yourself. That's not the way it should be. So meet the doctor first, and then if you've already got a diagnosis, they'll in fact even tell you why you get it and how you can prevent it.
So tests include like an ultrasound scan to look for stones, and even they will send your urine for assessment to check what bug, what bacteria has been affecting you. So in that way, then you can get the exact treatment, which will be much better, so that can prevent recurrence in future. Well, supplements and diet changes can increase your fertility, because when you take supplements, your body becomes healthier. Sperm count improves, and all these things are like antioxidants. Number two, diet changes. Yes, it's important. Well, if you keep taking diet with full of sugar and fast food, yes, you end up putting on a lot of weight. So if you start reducing those things, you get healthier and healthier, you may end up losing weight, and you may easily conceive after that.
But if things are not working out for you after a set amount of time, you need to set a goal. Okay, so if I try for this many months and if it's still not working, I'm not going to ask you to go on like this for another 2 years. So the crucial bit is to tell yourself how long you want to try this. And at the end of it, if things are not working out, it'll be best for you to meet a fertility specialist. And that's when things can be really detailed out for you rather than just going on forever,
So usually we advise, like after 6 months of trying and still not getting anywhere, then it's better go and get checked. They'll do an ultrasound scan, blood test, and then we'll discuss treatment options.
Is that why you got a lot of chocolates in your fridge? Right.
Yes, chocolates in the fridge.
Well, I think now lower libido has been in certain, like I know for men, I know they find if your libido is a bit low, they are actually looking at whether your vessels are getting clogged and they are very concerned about whether you have a heart problem. I think that's what's going on now. But if you feel you're persistently having a low libido, I think there's more to it. I mean, if you are a healthy young adult, you should be quite all right. So if your libido takes a dip, I really think you need to solve that first, and take it from there.
Well, low libido can also mean mental issues where stress, depression, or lots of things which can cause that. So it's always better to go and see a doctor, and you might end up seeing a psychologist and a psychiatrist to get that sorted out. If it's stress related, then maybe if it's related to your job, then probably need to change your job or modify certain things in your life to reduce the stresses. And that way, I'm sure most of the libido issues can be sorted out. Then the other things would be like when hormonal problems, like prolactin, certain type of hormones which are low testosterone. And if you can assess that, then you can get adequate treatment and your low libido issue can be sorted out. But things like chocolates and all, I'm not very sure about that.
Don't know. But I know there are certain supplements out there that may work. Chocolates, I don't know, that's going to give you diabetes.
And put on a lot of weight and worsen your low libido.
Yeah, so I think you need to choose wisely the supplements. I know there are a lot in the market. Actually, if you look at social media, they sell a lot of this stuff, and it's like, everything is written out there and very weirdly named and stuff like that. But I think, this is an easy way for us to be, going out and buying stuff that we don't know whether it works. And it could possibly cause a lot of harm too. So you have to be very careful on what you consume, because easy to consume, but the effects of it can last for very long. And I don't think it really helps with libido, but I think there are a few that's available. So you need to choose wisely.
Yeah.
Okay, so vaginal dryness, I mean, it is a problem, and I think there are a lot of ways of getting yourself lubes or lubricants outside to use them, and that makes it easier. In fact, if you are having intimacy without well lubricated, actually, from your first question, that's another reason why you can get vaginal discharge too, and candida and stuff like that. So, I mean, I think using a lubricant will help. In fact, I think there's now an update. There are a lot of newer lubricants that helps with fertility.
Correct.
So I think that's something you need to look at.
Yeah, there are a lot of lubricants out there. All depends on what you want to achieve. If you want to get pregnant, like fertility, then you should get sperm-friendly kind of lubricants, which will enhance their fertility. And secondly, all lubricants are not the same. So you must check what type you have and what type is available. And the other thing would be, and sometimes during a certain part of the cycle, there'll be more dryness, for example, just before the menstrual cycle. That's when the discharge may be a bit more drier. So if you have persistent problem in terms of like what you call dyspareunia, where you have painful intercourse due to dryness, then you should get it checked, because there may be other issues surrounding that problem.
Or you have other underlying problems, I think that needs to be sorted out. Stress. In fact, even if a horrible lifestyle or unhealthy lifestyle also can cause you to have, decreased libido and decreased secretions too at the same time. So get it checked out.
PCOS and endometriosis are two different things. Okay, so by taking some type of teas and all these remedies will definitely not reduce the problem. PCOS is when you have irregular cycles and you need to take some medication and to regulate the cycle, or even just losing weight. As for endometriosis, that will be, you have to do ultrasound scans and check whether you have any cysts, any swellings, for which you may have to undergo some form of treatment.
Now, these supplements, well, again, I mean, this is a very common thing in Malaysia. Everything, they want a quick fix, so it's easier to get the supplements and try to work things out. But A, you need to get your diagnosis, and B, you need to meet a doctor to get all this sorted out. These teas and all that, I'm not very certain. I don't think it really works. We are looking at things like evidence-based medicine. So for patients with PCOS, well, dietary, you need to change that. And even endometriosis now, they are telling you to slow down on foods that can cause you to have an extra estrogen count. So if you change your diet a little bit, all of this will make things better. In fact, that'll be cheaper than buying your tea.
Correct.
Really?
Yeah. Well, this is the end of this current video, where we shared certain things that they can help you.
And I think just choose wisely what you want to buy from outside and use. Get appropriate information first and advice before you attempt to try things out yourself. And don't treat yourself. Just go and meet someone. It's easier that way. Long term, you'll be far happier than trying things out on your own. All right?
All right. Till then, till the next video. Bye-bye.